One of the interesting things about the Spectra, though, and we talked about it earlier, is having an endpoint for caries removal. And there's been a lot of studies on the use of laser fluorescence in caries removal. And so we use our Spectra as a caries removal device. So this is a lesion that we were doing, and there's some decay still present. But looking at it, and even with my Explorer, it felt pretty good. But when I put the Spectra on it, I still had 1.6 into dentin. That's too many porphyrins. So I took my round burr, cleaned it up a little more, shot it again, caries free. So from an objective, because the last thing you want to do is leave decayed teeth if you don't have to, right? So excellent for the use of caries removal. So that is the Spectra, okay? That is laser fluorescence going on the screen, showing you the colors, putting a scale on it, pretty amazing. In the past couple of months, we started to use this second aspect, which is what we talked about earlier of interproximal decay. We know that X-rays for caries is pretty high in dentin, with a high sensitivity and specificity. Because when it shows up in dentin, there's a lot of tooth structure removal that's involved there. But X-rays are not as good for early lesions of enamel because it doesn't show up as well. And so it's important to diagnose because we can treat early, as we talked about, with resin infiltration potentially. More and more patients are concerned about X-rays. So, how often do you take bite wings? Do you take them every year? Or do you take them every 6 months? Well, how many times do you have patients say, I don't want X-rays? Well, maybe now we can say, okay, you don't want to take X-rays, that's fine. We're still going to use our Proxi-Head, and we're going to look and see if you have any interproximal decay. Very important. And it also allows me to visualize cracks and fractures and show patients the crack and the fracture much more pronounced. So again, this was that first case from before, and we were focusing on here. And if you look at the distal of that, maybe you can see a little bit of a triangle, maybe you can't. I'm curious that if we put 20 dentists in a room and 20 hygienists in a room, looking at this picture, how many of them would say there was decay there? Honestly say there was decay there. Well, there's decay there. There's cavity. There is a carious lesion, maybe not into dentin, but certainly into enamel, and one where I can now infiltrate that instead of having to cut a box into that. That to me is pretty, very important. So the Proxi-Head is illuminated with an 850 nanometer LED lamp, and it captures an image with a high resolution. And the images will display to having various translucencies of the parts of the tooth, with healthy enamel being the most translucent. So it really also depends on the water content of a tooth. And so it's not perfect. It doesn't work with amalgam restorations because the amalgam pretty much takes everything over it. But this is a pretty interesting product and one that's been a lot of fun.